We continue with the connecting Lu points. Liber 5, Woodworm Canal. Liber 5 location on the medial aspect of the lower leg, 5 June proximal to the highest prominence of the medial malleolus. Just posterior to the medial crest of the tibia, between the crest of the tibia and the gastrocnemius muscle. How to find? First, locate the highest prominence of the medial malleolus. From there, palpate 5 June in a proximal direction, and there locate liber 5 in a depression directly posterior to the medial crest of the tibia. Or quick method, divide the distance between the medial end of the popliteal crest and the highest prominence of the medial malleolus, approximately 15 June, into thirds, and locate liber 5 a third of the distance from the medial malleolus. Note some texts locate liber 5 on the tibia, others on the posterior border of the tibia. Sensitivity to pressure should be determining factor. Kidney 9 is located on the same level but directly superior to kidney 3, between the medial malleolus and the Achilles tendon. Needling liber 5.5 to 1 June vertically or obliquely in a posterior direction towards the fibula or transversely subcutaneously along the tibia towards the abdomen. Action and indication: liber 5 regulates liver qi, benefits the genitals, clears damp heat from the lower burner, regulates menstruation. Liber 5 eliminates plum heat qi and moves qi locally. For the special features, liber 5 is the Luo-Connecting point, important distal point for the urogenital region, especially with liver qi stagnation and damp heat. Liber 5 has specific affinity for the genital and urinary area. The liver connecting Lu channel departs from this point and flows up the inner aspect of the thigh to encircle the genitals. This point can therefore be used for any urinary symptoms deriving from stagnation of liver qi, such as distension of the hypogastrium, distension and pain before urination, and retention of urine. It resolves dampness in this area and is therefore used for hernial and genitourinary disorder with such symptoms as vaginal discharge, cloudy urine, swelling and pain of the vulva, pain in the scrotum, etc. Besides influencing the genital area, this point also affects the throat and issues for stagnation of liver qi in the throat, causing the typical sensation of lump in the throat and of being unable to swallow. This sensation is related to emotional tension, and it comes and goes according to the emotional state. It is called plump stone syndrome in Chinese medicine, as the person feels as if he or she has an obstruction in the throat. It also promotes the smooth flow of the liver qi, hypogastric distension, abdominal distension, resolves damp heat in the genitourinary system, hernial and genitourinary disorder, itching, swelling, and pain of genitals, swelling and pain of the testicles or vulva, priapism, persistent erection, abdominal fullness, difficult urination, retention of urine. According to the spiritual pivot, the liver governs the sinews, while the essential question says the genitals are the gathering place of the sinews. The liver primary channel encircles the genitals, and the liver sinus channel and the liver Luo-Connecting channel from liver 5 ascend to the genitals. Liver 5 is the Luo-Connecting point of the liver channel, is a major point for treating diseases of this area, and is indicated for itching, swelling, and pain of the genitals, and sudden pain and swelling of the testicles due to both liver qi stagnation and damp heat in the liver channel. Liver 5 is also indicated for inessant erection, priapism. The liver belongs to wood and spring, which manifests the energy of growth, spreading and ascending, and is entrusted with ministerial Mingmen fire, which has its source in the kidneys. Normal erection is dependent both on the flourishing of the kidneys and harmony of the liver. Incessant erection may arise either in the springtime of adolescence, when the kidney essence becomes abundant and the liver is exuberant, in which case it may be embarrassing but is not considered abnormal, or when pathological flaring of liver fire agitates and inflames the penis, in which case it is pathological and distressing condition. Liver 5 is one of the few points specially indicated for this disorder. The ability of liver 5 to clear liver qi stagnation and damp heat extends to the lower jiao as a whole and is indicated for red and white leukorrhea, Shan disorder, distension of the lower abdomen, qi accumulation below the umbilicus like a stone, prolapse of the uterus, difficult urination, and retention of urine. Uncommon with many of the Luo-Connecting points, especially of the yin channels, liver 5 treats a variety of psycho-emotional disorders. The liver channel ascends to the throat, and according to the number of classics, including Great Compendium of Acupuncture and Moxibustion, liver 5 is indicated for worry and oppression, stuffiness in the throat, as if obstructed by polyp. This refers to what is more commonly known in Chinese medicine as plum stone, globus hystericus, a sensation of physical obstruction that fluctuates according to a person's mood. Plum stone qi is most commonly due to stagnation of liver qi and accumulation of phlegm. Liver 5 is further indicated for depression, pride palpation, palpitation, and fear and fright. These latter indications reflecting the statement of the spiritual pivot: when liver qi is deficient, there is fear. The liver stores the blood, and the smooth flow of blood depends on the free flowing of liver qi. The liver, therefore, has a close relationship to the menstrual cycle, and liver 5 is able to treat menstrual disorder such as dysmenorrhea and irregular menstruation due to qi stagnation or blood stasis. Due to its ability to treat depression, it is specially indicated when the symptoms accompanies menstrual disorders. The liver has the function of both spreading the qi and nourishing the sinews. It is interesting to note that in common with several other points of the liver channel, liver 5 is indicated for inflexibility and pain of the lumbar region, reflecting the clinical importance of liver pathology. Liver 2 in some disorders of this area. Finally, the Great Compendium of Acupuncture and Moxibustion gives specific indications for excess and deficiency of the Luo-Connecting points. In this case, liver 5, these are persistent erection, excess, sudden itching of the genitals, deficiency.